It's very fulfilling actually to say that it's the last session, last day of the conference, but we should understand that it actually is a start of the work that we are going to do for the coming years, kind of changing it. And I would like to highlight that one of the main objectives of this session is to review the roadmap. We have seen that we have had like 5 themed sessions for the last 3 days. We have had presentations from experts. We have had very mindful and thoughtful deliberations. We have seen where the challenges are. We also have heard, we have listened, we have actually made our voice heard as well. But then this session will make sure that you put all these things, we all put all these things on paper. When we put all these things on paper, it's very important that it is doable, implementable, and outcome-based, whatever we are going to write in the roadmap, okay? And I'll tell you a little bit on this session. In this session, the first will be a keynote by a keynote speaker on motivation to public service. And then we have a video on public health journey, then introduction to roadmap by Dr. Afzal. And after that, we'll be having the group work, and we'll give a brief on the group work later, okay? Having said that, we have to have this work and to go ahead with this work. I think it's one of the best things that we have a very we have a very esteemed speaker here as a keynote speaker, Mr. Hussein Afif. He is an executive director from John Maxwell team for the Maldives. He has he is an internationally certified speaker, a coach, a trainer, Marshall Goldsmith stakeholder-centered coach. He is also the regional director of training, development, and quality assurance in Lux Resorts and Hotels. And also he's the president of the Maldives Association for HR Professionals. He's got 15 years of experience in hospitality industry with extensive experience in quality change management, service strategy, and also something very important, which is employee engagement, employee marketing, branding. These are things that we really need. And he's also been awarded a leadership award in 2016 and 2017. Also, he's been awarded as being amongst the 100 most influential global HR professionals in 2006. So I would like to welcome our keynote speaker, Mr. Hussein Afif, and you will be part of the session, not only listening. I believe this will be a very interactive session.
Thank you. Assalamu alaikum and good afternoon, everyone. How is everyone doing? Very well? Good. Is this the first day of the conference or the last day? Okay, very good. So I have a question for all of you. Now, I know we are running a little bit late, but don't worry. You know, when Nisham asked me to speak in this conference about 5 days or 6 days ago, I was in fact in Singapore speaking in the conference, and I asked him, what do you want me to talk? Right? And he said, well, this is a public health service conference, and all the participants are serving in the sector of health. So we discussed, and I met with Dr. Sheena. We had a couple of ideas. So I do have a very good presentation for all of you. But before we do that, there's something we need to do. Okay, are you ready for that? Good. Now, you see the way I do these sessions, as you would already notice, is very different. Where's the clicker? Okay. Put the slide deck. Now, the way I would do this would be very different. To do this, you need to be seated with someone next to. So you can't have like the gentleman over here. I would recommend that you probably move to someone, right? Because you will need someone to speak with you. Okay, so would you please, if you're alone, even Nisham, you. Yes. Good. All right. So here's what we're going to do now, okay? Because I have about 20 minutes or so. I know we're running a little bit late, but I think I have a very important message to share. So this needs at least 20 minutes, and I'm sure Nisham can forgive and Dr. Sheena can forgive even if I take more than 10 minutes. So, are you ready? Good. So, for this exercise, I actually would need to use the podium, which I often don't use when I speak, actually. But let's see. You can hear? Oh, my God, this is too loud. Okay, you ready? Good. So, take your 2 hands up. Everybody? Good, good. Where's the photographer? You should be taking some good photos of this. This probably is the... No. You should take photos from the front, photographer. Okay. So take your 2 hands up and rub your hands together. Rub. Clap 3 times. 1, 2, 3. And keep your hands like this. When I say go, okay, either you turn to your right or left and give high five and say, please be my learning partner for this session. Okay, because we're going to learn from each other. Okay, ready? 1, 2, 3, go. Once again, like this. Clap 3 times. Turn to your right or left and give high five and say, welcome to this session. Good. All right. So, we are ready now. You see, my topic here is building a world-class service culture. Now, how many of you are doctors? Raise your hand. Good. Okay, nurses? Nurse? Okay. And administrative staff in hospitals, clinics, right? Anyone from the private sector here? Good? All right. So here, what are we going to do? Now, I'm sure you are here because there's a reason why that the organizers, Ministry of Health, invited you to be here. Between 1 to 10, when I say go, turn to the person next to you, what is the level of service, or how would you rate the level of service that you are providing currently to the citizens, to the public, right? Including me, because I'm also one of you. Yeah? So, when I say go, you talk to the person next to you, what's the level of service between 1 to 10? And be honest to yourself. Don't say 10, because if you say 10, we can go out of this room. Okay? Are you ready? Go. 1 to 10, what's the level? Good. So, come on back. How many of you say you are 10? Good. Nisham, you should take a picture of this audience. There's room for improvement. Okay, how many of you say 5? Very good. Anyone say like below 5? 3, 4? Good. Because the most important thing we need to understand is if we want to improve, we need to know the truth of where we stand today. Otherwise, we will not be able to go anywhere. We can have conference every single day. Because, here's what's going to happen. After my talk, you're going to be very motivated. You're going to say, oh, wow, this is great. I think we can do these things in our clinic, in our hospital, everywhere. But the motivation has nothing to do with what you will do when you go out of this room. Have you ever felt like you attend a talk or a conference, like you're very motivated? The moment that you leave, something else happens, right? So I think that's an important thing. Oh, you can't hear me? Can you change the mic? Oh, you want to change the mic? Oh, this is good. Yeah. So, building a world-class service culture, right? And I also have one more thing. I would like everybody to think, because I am not from the health sector. I'm on the side of receiving the services. So, I think this conference started on the 4th, so the last 2 days, including today, there's a lot of technical talks, a lot of skills related, lots of things that we need to improve on. So my talk is purely based on how we can create a service culture around this. So look at this. What you see here is called building a world-class service culture within the public services, health services. Now, whether it's a hospital, whether it's a clinic, whether it's any, whether private owned or publicly owned health service, the most important thing that anyone would measure the level of service that you provide is how one is treated when they go to a hospital. Now, I'm going to give an example, but I would like you to have a very open mind under this. One day I went to a hospital because I needed to get a view from a doctor about a specific surgery that I needed to do, and that happened in the Maldives. I will not say the name of the hospital. So I took the number token and I waited for about 30 minutes. I got in. And I'm okay to share this on this audience, by the way. I waited, I got in and there was no greet. There was I suppose the nurse assistant, and the doctor was on the phone. And I sat down and I was asked, what's wrong? So there was one example, okay? Now then I had the interaction and I shared what I needed and then I got the recommendation. So I went to another hospital abroad. There was a hospital in Singapore called the Raffles Hospital. Probably some of you know. I mean, they're probably good. I mean, of course, very well known. So I took a token, 20 minutes wait. Waiting time is okay because hospitals, that's what kind of expected, you know. So I got into opened the door, the doctor's cabin. As I opened, the doctor looked at me and said, "Hi, good morning. What can I do for you?" I was like, no, I'm okay now. I'm fine. Thank you. Because in the first case, I was like, I have two problems now. The actual issue and, a service situation where it's not specifically very friendly. So look at these two. Two doctors, by the way, both are specialists, and I'm sure they must have studied for the same period of time, right? So here's the situation. The first doctor versus the second doctor. Forget about the name of the doctor. Which hospital you would prefer, the first or the second one? Why would you prefer the second one? Well, because it was a great service. So here's the thing. Talk to the person next to you. What's wrong between these two hospitals, 1 and 2? What's wrong? Have a conversation, please. Have a conversation. What do you think is missing here? All right. Come on back. I heard someone say funding. No. I heard someone say infrastructure. Let me tell you something very, very clear here. Whether you have the best hospital infrastructure in the world, if the people who works, starting from the cleaner of the hospital or to the CEO, if you don't understand why you have a job, your hospital will always be a hospital. Because there are many hospitals in the world, but there are not many hospitals, there are not many good hospitals or good clinics that provide great service. Do you understand? See the difference here? Right? And this is what we need to understand. And then your question would be like, all right, so what am I supposed to do then? Right? Now, here's the first thing that we need to understand. And this is an example of a model that I wanted to share with you. What you see in here is basically what we call as the service culture. I only have 20 minutes. I can't teach everything. I wish I have a day, and you're going to love it. Okay? But not today. Now, this is what I'm doing. Right? The difference between these two doctors are because, when we go to a hospital or a service area, we want to receive the care. Right? We want to receive the empathy. We want to be looked after. Right? And that probably didn't happen in the case one. Now, I want to give an example here. How many of you use a smartphone? I guess everybody uses one here, right? How many of you use an iPhone? Samsung? Okay, would you talk to the person next to you and say, why do you like your mobile brand? Tell them, why do you like it? Tell them. Am I good with the timing? 15 minutes more. So, Haji, how are you? Good? All right, come on back. Well, there's one reason why. Well, there are many reasons, but the biggest reason why you love it is because every quarter, every 6 months, there's a new product coming up. Now, the mindset 1.0 refers to we are always doing it the same way, expecting a different result. Right? So you could have, for example, a clinic, right? Let's say a private clinic. You've been operating the clinic for 10 years, right? And you updated the infrastructure, you put new machineries, you brought some of the best doctors, but if the mindset of the people is not changed towards a different level, the tendency to provide a great service to the public or to anyone who goes to your clinic to get the service will almost be impossible, right? I'm sure some of you here would have heard this. When you want to bring a change to your area of work, there's always a team who says like this, we have always done it that way. Have you heard about this? You know what? That is one of the killer of providing great service. I do not know any medication has been yet produced for that. I hope one will do a research, but the medication is within us. We need to be open for change, right? And everybody here says, yeah, we got to change. But when the change needs to come, you're the first one who says, no, I cannot change. I'm happy with where I am. right? So that is what we're talking here about Mindset 2.0. And I really hope that when I go through the next slide, you understand what this means. Because I'm going to share some examples outside from the health sector. Are you ready to hear? Good. I'm sure everybody here, you must have traveled somewhere, right? I mean, either abroad or domestically, right? So when I show you this picture, you probably know what that is. What do you see here? No, it's not Singapore. It's an aircraft. Right? Which other airline can have this aircraft? Anyone can have this. Because if you have the money, the funding, the capital, anyone can go and buy. Right? Because in today's world, where the product differentiation is almost the same, everybody can have one of these. But my case study is this. How come this airline has been awarded as the #1 airline for many, many, many years, over 22 years in a row, #1 airline in the world? Talk to the person next to you. What do you think? Come on. Well, I guess nobody said, oh, well, it's because of the aircraft, right? No, it's because of, oh no, not because of this girl. It's because of the service. It's because of the way you are dealt, right? So here's an example. You see, you can have the best infrastructure, but if the mindset, because you see, here's the thing. These cabin crews are trained in a way that when somebody gets onto their aircraft, they want to make sure that he or she will have the best flight ever, every single time. What's your commitment when somebody walks into your hospital, your clinic, your office? What's the level of service that you intend to provide? Think about that. Think about that, right? And I will give you one more example, right? I mean, I wish I had more time, but here's a picture of one could argue, but this is the best airport on the planet for the awards that they have received, Singapore Changi International Airport. Now you will say, well, it's because of the infrastructure. No way. It's because of the service that they provide, it's because of the people there, right? So what is the key learning here? And this is, there are many examples like this. I purposely did not include a hospital example, right? Because I want to teach you something different. Because I've been talking about health sector and hospitals and everything else. So I thought I want to bring something different. Amazon is known for this, right? Starbucks is known for this. And all of this, if you look into all these different brands, there's one thing common. Number one, every day they come to work and they ask a question. What can we do to make your lives a better one? What can we do to deliver a service that you probably never anticipated, right? And number two, how can we add more value to you, right? And what do you mean by how can we add more value? Welcome, Minister. Let's give Minister a round of applause. Yeah. So the question is this. Where are we right now? Now, if we look into the service, now I've shared a lot of examples. Where are we right now? The general health services throughout the country, where are we today? Now, this time you're not going to rate, okay? Now, here's the thing, okay? So we're going to look into 4 different, categories of rating. The first one is average. I'm not going to use the word poor. It's going to be average. So average is right over here, okay? And then we have good. Good is over here, okay? Over here, okay? And very good is here. Outstanding is this much, right? Not up to the ceiling, all right? Sorry, okay? So when I say go, talk to the person next to you. The health sector right now, in level of service that we provide. Forget about the infrastructure, forget about the resources, forget about the funding, forget about the service. Service that we provide to the citizens. Where are we today? Ready, go? Average, good, very good, or outstanding? Talk to the person next to you. What do you think? Because you see, okay, how many of you say average? Raise your hand. Yeah, thank you. Minister, we have a lot of work to do here. And we can do it. How many of you say good? Very good? Outstanding? Why don't you all give yourself a round of applause? Come on, ready, go. Give us. Yes. Nisham, we should organize one more session like this. Because now I realize the things I have to do. But anyway, I mean, you're absolutely right. Because you see, outstanding is this. Recently, the world's #1 marathon runner from Kenya, Eliud Kipchoge, he did an interesting thing, which was sponsored by Nike, because he was given a task to run, within 2 hours, within the time frame, a marathon. Outstanding means he was supposed to, if he went like 2 minutes, 1 second, out. There won't be a record. 1 hour, 59 seconds, 59 minutes, 40 seconds. That's an example of outstanding. If you went like 2 hours, 1 minute, 1 second, you have to do it again. You see that? That's what outstanding is all about, right? And this is what happens in some service cultures. Nobody knows what it's supposed to do. Now, you have been spending 3 days here, including today. I don't know what time you're going to finish. Maybe 5 o'clock, 6 o'clock. But I have a humble request for you. You have spent 3 days here. What you have learned, the commitments that you have made, the discourse that you have, you need to put it from that confused service culture to an aligned service culture. You need to walk. Because I believe this plan is for 5 years, which means there's a lot of things that you can do in 5 years, right? And if the service that you provide can be aligned throughout the government and throughout everywhere that provides health services, the result will be even better. And here's the difference between service training and service education, which is very important for health sector. Training will be how to train someone to be a nurse and a doctor and a clinical assistant and a technician, right? When your pilot gets into an aircraft and you are up in the air, 33,000 feet, do you want your pilot to be creative? Like there's an emergency and the pilot says, "Hi, ladies and gentlemen, the 2 engines are out. Let's be creative." No, of course not. Because what are you supposed to do? You are trained, so you're going to follow the procedure. Right? Now, this is a health sector example. When the doctor goes in, do you want the doctor for surgery, you want the doctor to think outside the box? Do you? No, of course. One said yes. Please, doctors, please take care of him over there. Of course not. But in our business, whatever happens, right? The citizens go to these places to get service. You need to think for them. You need to be nice to them. You have to always remember this. There'll be one day you will walk into one of those hospitals or a clinic. How would you like to be treated? Regardless of the level. Doesn't matter whether you are the in charge of the hospital or whether you are the CEO of the health sector in that particular area. How would you like to be treated? So if you are the hospital manager and if you see a patient, you need to greet them, you need to talk to them, right? The biggest problem, here's the thing. Hospitals are the most stressful places in the world. You agree with me? Yeah, that is the reality. We can't change it. Because here's what it causes stress. Get the number, wait in the queue line. You all know, right? Everywhere it happens. Not only in the Maldives, by the way, the whole world, right? And you, if you are a servant in the health sector, could actually change. There could be someone sitting right at the queue line, and you could see the body language of the person is not quite feeling well. You could actually go and say, "Hi, are you all right? Can I do something for you?" That could change the level of stress. That could actually make the person feel much better. When was the last time you did that? Here's the problem. We are asking for things that we're not willing to do by ourselves to other people. And that's not going to work. Right? When Nisham asked me, "Can you come and speak in..." I just landed from Dubai. I was in a conference speaking in Dubai yesterday. I flew last night. I arrived here at 11 o'clock. I could have called Nisham and said, "Nisham, I'm sorry, I can't do this." Because the flight landed actually 1 o'clock. He knows that. And I changed in the airport. I think I still look good. Right? Because I wanted to do this for all of you. Right? And I wanted to make sure that I deliver this message to all of you. Right? So the actionable service education is something we need to understand. We need to teach to everyone. And by the way, if you are, let's say a hospital manager, don't wait for someone else to tell you. Gather your team. Teach these things to them. Right? Because if you wait, you will always be waiting. right? And don't wait for the Ministry of Health send your circular and say, take responsibility, and that's what I'm going to come at the end, right? Now, there's something called outstanding and excellence. About 5-10 years ago, a lot of people, they travel, they use a lot of money. Nowadays, they don't use a lot of money, right? Probably you have credit cards that we use, right? Yeah. And one day you forgot your credit card, it's okay because it's in the thumbprint now in some parts of the world. And one day you forgot your finger, it's okay. It's in the, right in here. You go to the ATM machine and you speak to the ATM machine. Hi, Afi, welcome. Press the pin and money comes out. What does this mean? The world is changing, right? And as the world changes, the service that we provide must also needs to go along with it. I repeat, you cannot have a great infrastructure expecting that the citizens are going to be happy with the service, because the infrastructure, what you touch and feel, has nothing to do with what human beings provide. You can have a broken door in your clinic, but the way the doctor greets, hi, good morning, what can I do for you? And then the patient goes, oh no, I'm okay, thank you very much. Right? Because that is really what we're talking. So ladies and gentlemen, as I come to the very end of my topic, service excellence is taking the next step up to create more value for someone else, which means as you leave this conference, when you are going to work on your action plan, I really encourage all of you to put a point for each of your clinic and hospital and whatever the department or division you work, a section on service. How can we improve? And here's one more thing. I am not talking only about service to the citizens. We have to have a great service between each other before it can go somewhere else. Because let's say, for example, if one day I happen to work with Nisham, by the way, Nisham and I know, so I can share this joke with him. Let's say one day if Nisham and I work together, if I am not committed to provide a good service to Nishan, but you told me, oh, okay, never mind. Yeah, almost the same. Right? Yeah. Oh, he's a great guy. So Nishan, right? And if I did not provide a good service, I cannot expect this to provide this service to 350,000 or more citizens in the country. It starts within you, right? If you are not committed to provide a good service to the person on your right, on your left, it will never happen within the sector. I believe everybody here works with each other one way or the other, right? So would you please have a conversation with the person next to you and just say, look, I am committed to provide a good service. Will you make sure you do the same? Have a conversation. Hey, Nisham, 5 minutes, huh? Okay. All right, my last part. I am sorry, organizers. I know I'm taking a little bit of time, but I hope you enjoy. Are you having a good time? Yeah. Good. Do you want me to stop? No. Thank you. All right. Here's my last part. Please listen this very carefully. Now, the biggest problem anywhere in the world, any companies to provide great services, this. Let's say we're a hospital. We had a problem. And I went and asked from this division, hey, sir, we have a problem here in this department. And then they tells me, what's your name, sir? Shahrab. Shahrab tells me, oh, you mean because of the people like them over there? Okay, then I said, okay, let me check. I'm going to say, hey, I heard that there's a problem. Oh, you mean because of the people on that side of the table? Blame. It's easy to blame and say, they didn't do it, he didn't do. That is not going to give us anything anyway. Right? And then we say, oh, let's be nice to each other. And now we go to the next level, which is shame. Like we made a mistake and we say, oh my God, I made a mistake. I can't get anything right. How am I going to get this right? Because if you are not in the right mood to provide a great service, no one's going to be happy with the service anyway. You can't even provide a good service to your internal employees, right? Then you say excuses. Well, it's the light problem. It's the ceiling. No, it's the projector here, right? This is what we need to do, ladies and gentlemen. We need to get rid of these three things in our culture, and we need to take personal responsibility. If something goes wrong, let me give a simple example. You are one, let's say there's a health center. 20 people walks in. And one day you are the one who went into the restroom of the health center. The light is fused. You have two choices. One is, that's not my job. Actually, the engineer will come and check it. You can do that. Or you could see the light is fused. You could pick up your phone and call someone to come and fix that. When was the last time you did that? Think about that. That's what we're talking about taking. I'm not asking you to invest your personal money into something. Taking personal responsibility is taking personal responsibility for where you walk and what you're supposed to do. And to do this is a mindset. I was traveling recently and I was in Mauritius airport. And there's about 400 passengers in the queue line for immigration because we just arrived. And I learned this 13 years ago when somebody taught this to me. Right across the immigration queue line, there was a piece of tissue paper. I took the tissue paper, I put the tissue paper into the dustbin. Everybody else looking at me like, who is this guy? And I just got back into the queue line. You know what? I felt very good because all the passengers who came after me, there's no tissue paper. That's an example of taking personal responsibility. What do you need to do that in your service sector? Right? And this is the message that we need to understand, because if you do that, things will get better around where you walk. So as I end this note, I would really like to give you this message that if you take personal responsibility for what you do, things are going to be even better. And here's an example I like to share. Would you like to hear a story? True story. This is a picture from Northern European country, Sweden. So it was taken during the winter time. And a story relates, and this is a true story, was told to me by the guy who encountered this experience. So a Microsoft executive from California, which is usually a very warm weather, visited during winter time to Sweden, and he was picked up by his Sweden colleague to go to work in his factory. And as they pick up in the airport, it was Sunday afternoon. He said, tomorrow is Monday, we're going to walk. I will pick you up 8 o'clock in the morning. Factory work starts at 9 o'clock. There are 3,000 employees who works in the factory. Everybody comes by a car. There's a big parking space. Monday morning, 7:45, he went and picked up the guy. They reached the parking space very early, like 8:15. So there's a lot of empty space in the parking area. The Sweden guy went and parked the car at the farthest empty slot. Now, this is winter time, and the guy from California is not used to this. As he got out of the car, he put in the winter jacket, and he said, hey, why did you park your car so far? I mean, the factory, is empty, right? He said, oh, you don't know this? Okay, let's walk. So they keep on walking. It took about 8 minutes to walk, so you could imagine it's a very big parking lot here. And as they got into the factory, they removed the jacket, and the Californian guy, the US guy, asked, hey, what did you do just now? It looks like it's crazy. And the Sweden guy said, oh, you don't know this? It's my colleagues who will come to work at 8:45, 8:55, 8:56, 8:58, 8:59, who will need the parking space closer to the entrance of the factory. We arrive early. We have all the time to walk. And this is why I parked the car over here. Don't you understand? And the US guy goes like, huh? Is that how you do in Sweden? Did you like the story? It's a true story. Story by the guy who experienced it, the Microsoft executive guy. But you see, the key thing is that if we don't do this for each other, you can't expect this to be done for somebody else. It has to start from this room here. It has to start from every single one here. Turn to the person next to you and say, it starts from you. All right. And if you like good service, you got to take responsibility. We all have to take responsibility and to be a role model in the service sector. And here's the thing. Whatever you do, you're providing service. Right? Forget about what you do in the health sector. You're providing a service. And I like to end this with 2 more examples. And what do you see here? Good. It's a mountain. To put this guy up at the mountain, he can't do this alone. He needs a team behind, right? Following him. Right? And the team on the ground. Because if something goes wrong, they could all help him But eventually, who gets the medal? Yeah. Because I've never saw any climbing, adventure where everybody got the medal. Right? So what is the key point here? We got to help each other because it starts from us internally. And look at this picture over here. Right? You know this car racing? Right? Look at this picture here. Does everybody in this get a medal? No. But if one guy over here doesn't know what he's supposed to be doing or in a bad mood, it can ruin the entire experience. To put the health sector a bad name, you don't need 400 people to be rude. You need one rude staff in any clinic. This is very powerful, remember. I do not know how many service staff in the health sector. You need one person to be rude to one patient and you will get a very, very bad reputation. But you know what? Also to get a good reputation, it's the same thing. If one patient goes to a hospital and you are treated really nicely, if he shares that with somebody else, it compounds. The power is within you. The power is not within the infrastructure. So this is really what I would like all of you to understand, because if you provide this service, right, it's all about taking care of someone. And it creates a better place for everyone to work and achieve. Imagine if you apply a little bit of what I've shared with you, what is going to happen to the service within your area of work. Because the reason why we are here is to take care of each other. And that's what we do. But it has to start from us. It has to start from the person on your right and left. You can't say, well, today is Friday, so I can't do it. Right? Every single day you have to do it. Because when we all do it, our community improves. And we're a small country. If there's one country in the world that can have the best service sector, it is the Maldives. And you can do it, but it won't happen unless we do something about it. If you go back to work on Monday, I guess tomorrow is Thursday, maybe some of you go back to your islands, or whenever, start from the day you go to work after this conference. You start being nice to everybody in your team. You start being nice to the people who come to your places to get service. That's where it starts. Because in the race of excellence, there is no finish line. We're in a sector where we can't say we are done. No. Every day is a day where we need to explore and we need to keep going. So I really hope that we had a good time together. Right? I hope you enjoyed the conversation. I wish I had more time to develop some more examples, but thank you very much for listening. And I really hope that as we go out from this room, the motivation, the learning, the things that we have discussed here does not go into somewhere else, that we start taking action. Because if you give one smile to one employee in your team, it compounds and compounds and you never know the power of it. Right? So, turn to the person next to you. What did you learn from this 25 minutes, I think I spoke? What did you learn? Have a conversation with the person next to you, please. You have 10 seconds. Have a conversation. What did you learn? I'm very sorry that I've taken water. All right. Take your two hands up, everybody. Two hands up. Let's do the exercise. Two hands up and rub your hands together. Rub, rub, rub. And clap 3 times. 1, 2, 3. And turn to the person next to you and say, thank you. Ladies and gentlemen, have a nice afternoon. Thank you.
Thank you so much, if I may say, Afif. It was very interactive, right? We want it again. Okay. I think we can reflect back. One thing is that Mr. Hussain Afif is not from the health sector. He has given his perspective, somebody from outside the sector. I've just noted some of the words he has said: personalized care, people-centered, to be looked after, empathy, changing the mindset, and welcome, Minister, to the session. And I think we talk about customer service, and when he has said actionable service education, we hope Minister will give his commitment that we have this kind of training to our own people. One of the take-home messages that I have written down here is that commitment and personal responsibility So let's give a round of applause to our keynote speaker, Mr. Senafif. Thank you so much. Next on the agenda, we have a video on public health journey.
ಮುಜ್ತಮೌಗೆ ದುಳಹೆವಕಮ ಸಿಹ್ಹಿ ರಕ್ಕಾತಿರಿಕಂ ಇತುರುಕೊ ರಂಗಳು ಆದತಂ ಅಶಗೆನ್ನೆವುಮ ಎಕಶೀಗೆಂ ವಾ ಸಿಹ್ಹಿ ಮಾಲೂಮಾತ್ ಫೋರ್ಕೊದ್ದಿ ಬಲಿತಕುಂ ರಕ್ಕಾತಿರಿವುಮ ರಯ್ಯತುಂ ಬಾರುವೆರಿ ಕುರುವುಮ ಎಕುಲವಾಲಂಜೆ ಸಿಯಾಸವತಂ ಎಕುಲವಾಲುಮಕಿ ಆಮು ಸಿಹ್ಹತುಗೆ ಎಮ್ಮೆ ಮುಹಿಮು ಬಾತ ದಿವಿಹಿ ರಾಜ್ಯಗ ಆಮು ಸಿಹ್ಹತು ರಕ್ಕಾತಿರಿಕುನುಂಗೆ ಮಸೆಕ್ಕತಕಿ ಎಮ್ಮೆ ಕುರಿಸುರೆ ವರದ್ದತಿ ಹಾಲುಗ ರಯ್ಯತುಂ ಗಾತಗ್ಗೊಸ್ ರಯ್ಯತುಂಗೆ ಬ್ಯಾವರಿವುಮಾಯಕು ಹಿಂಗಮುಂದ ವರ ಕಾಮಯಾಬ್ ಮಸೆಕ್ಕತೆ මේ මසෙක්කතුග හරකාත්තර වෙදෙව්වි සිහ්හි ඛිදමතරිනකි රයියතුන්ගේ ලොයිබා මක්බූල්කන් බර බොඩ ලිෆාවා රයියතුන් ඉතුබාරු කුරා බයක වණි වෙගෙන් ගොස්ව මීගේ ෆන්සාහකන් අහරු කුරින් ෆෙෂුණු මේ මසෙක්කතුගේ ෆෝනි මීරුකන් මියදු ෆෙන්නමු මෙදනි එකි දුවසොර මතින් සරුකාරා සිහ්හි මසෙක්කතරින් කුරවි බුර මසෙක්කතවගේ සබු මැලේරියා ෆද ගෑංගයන් අරා බලිත රාජ්‍ය නත්තාදා ෆවාකන් දුනියයිගේ සිහ්හතු ජමියයන් කෂවරු කොද්දමුන් දායරු මිකමුගේ ශුකුරු හග්ගු වෙගෙන් දනි මිදෙන්නවි සිහ්හි ඛිදමතරින්න
ಗೆ ದೊರೋಷನ್ ಬಂಗಿರು ಇವೆ ನ್ಯೂ ಬಾರ್ನ್ ಬೇಬಿ ರುವಿಯಾಡು ಆಗುಂಡು ಎತ್ತಿನ ಬದ ಹಬ್ಬನಿಕೊಮ ದರಿಫು ವಿಹೈದೋಯ ರುವಿಯಾಡು ಹೀಮೆ ದೆಮೆದೊರ ನೋಡು ವಿಹೆ ದೆ ಬಲಾದಿರು ಏನ ಫೂರ್ಮಾಯಿಂದನಿ ಮಿಹಿಸಾಬು ಗೊಸ್ ಎಲಿ ಫೊತ್ತಿಗಂಡು ಮಿಹಿಸಾಬು ಎಲಿ ಫೊತ್ತಿಗಂಡು ಗೊಸ್ ಏ ಮಾಯ ಮಿಹಾಗ ಬಂಡುಗೆ ಮಿಹಿಸಾಬು ಗಾಳಾಫ ತಿಂಕಿನೆ ಬಿಹೆ ಕಂಗಂಗೆ ತಿಂಗ ಆಗುಂಡು ಫಿಂಗ್ ಮಿ ಫೊತ್ತಿಗಂಡು ಆಗುಂಡು ಎಕ್ಕ ಫೊತ್ತಿಗಂಡು ಗಾಯಿಲ್ಲ ದುರಿಲ್ಲಾಫ ಆಗುಂಡು ಬಾಯದಿರುಗ ಏನಗೆ ಫ್ಯಾಗ್ ಹತರು ಇಂಗಿಲಿಂಗಿನ ಎಕ್ಕ ಕುಜ್ಜಾಫುಳು ವಿಹಾಸ ಕುಜ್ಜಾಲು ಏನಕನ್ನೆ ಕುಜ್ಜ කියන නේවාර අගොල්ලන් ට්‍රේන් කරන් ෆෙසි හැම කුරිහාර සෙග්ගස් කියවා නරුවක මිඩ්විෆරි ආච්චි කියවා කුජ්ජක බාට්ට ඉහත් බෑනි කොම්ම අතලගේ හෙල්තුවා කර කොම්ම රසකාවුන් කුත්ත ෆෝන් කියවා විස්සංගේ අහමදෙල් මේ ගෙන්දා විදාල්වි ආව මේ හොස්පිටල් මාසිකතනි කුන්නාෂේ දැන් කොම්ම මාවඩේ ගෝලිස් දාන්චි රේනු දාන් තින් පාරුනඩ දැන් ගොස් දාගුණ ෆෝන් ඕස්ට්‍රේලියා දැම සිසසිසන් කොම්ම දෙ හේලේ ෆොටෝදස්කෝ දොර්ගජායන් ඉවති කියවාගෙන නර්සින් මිඩ්විෆරි ඇන්ඩ් පබ්ලික් හෙල්ත් අගුණ හැම ඩේ වන උසර පබ්ලික් හෙල්ත් ඉන්ක්ලූඩ් වක් කොහෙග මේ අර හොස්පිටල් ගාගුණ ෆස්ට් පේෂන්ට් ඔල්ලි බෙන් එත කොම්ම හප්තා ගස් එතන ඒ පේෂන්ට් එක ගියක් ගොස් බලන් ජේනේ නේ බරජුනි කීර බෙගෙන් තො ප්‍රිවෙන්ට් කුරන් කොන්කවෙත්ත කුරන් තී
අද අලගොන්ඩක වාහක මේ ෆැෂනි නවස්ථායක හද්දිහායක අහර්තක් තෙරෙක්කම බායරුග දිවේ රාජ්‍යයක එම්ම ෆුර්තම සහි ඛිදමයි වගේ නිසාමයේ දරුන් දෙන් ෆැෂනි එදව ස්වර්ග ඒ රාජ්‍යක حالتක් අලගොන් මේ විස්නාලායරුග රාජ්‍යයක ડોක්ටරුන් තිබිනි ස්පයිබස් දිහා ડોක්ටර් නම්වර මදු දැන් රාජ්‍යයක හොරි එම්ම හොස්පිටල් දැන් හෙල්ත් සෙන්ටර් හොරි හතරතන් මිකාල حالتේ ගවුණුගේ තිරේගොති ඒ සහි ඛිදමයි දිවිගත මට්ටක මිහුන් දාංජි හෙතත් දැන් දුනියේගා සහි ඛිදමයි වකිගතක දිනුමට්ටක අල්මා ආටායමි නිම්මනි හද්දිය අවවන හරුග තිරේගා ඒ ප්‍රයිමරි හෙල්ත් කියාගේ උසූලකි උසූල්කමග බලාගෙන් දෙහස්වන ආහාර වන්නෑර දුනියේගා දිරිවල කොම්මෙ මීහක සහි ඛිදමයි ලිබිදේ ෆෙම්බරගේ බේපමට්ටක මි කන්ත අවුන්මෙන්ගේ රාජ්‍යයක පරම් බලාරුග ඒ ඛිදමයි ලිබිදේනේ අවුන් මෙන්ගේ ඔයි උලන්දකි ෆොලන්දකි වර මදුවෙච්ච සහි මර්කස්ත නෙක් සෙහි ඛිදමත් දෙන බය මදු එහෙම අලුන් මෙන්න ජහුනි ඒ මිදෙන්නේවි හද්දිහා ගහර්ත නිමුන් ඉරුගා දිවේ රාජ්‍යක සෙහි මෂ්රූවරාව රාජ්‍යක එබ්ස් මෂ්රූවේක දරකොන්න නෝ රාජ්‍යක සෙහි ඛිදමෙන් එර දෙමු හිසාබ ගෙනස ඔතිකි ඉපල ගෙනවා මුලි රාජ්‍යක හෙල්ත් සෙන්ටර් එයා මදුන් හොරපත් සෙහි ඛිදමෙ ලිබිගන්න බයක ලිබිගන්න දෙවේන නිසාමෙන් නැතිෆා හොස්පිටල් එක හොරි එමෙ තනේ ડોක්ටරුන් තිබි වර මදුබයි පිම එහිසාම අලුන් මෙන්න මජබූර් වෙච්ච දිව රාජ්‍යයක සෙහි ඛිදමයි බකි නිසාමෙගේ දරුන් දෙන් අඬයන රාජ්‍යක ඒරු ආම සෙහි حالتක් අලුන් මෙන් එමෙ ෆුට්නෝ බෑදීරුක වාගතුකි මෑගන බොඩු තින් හතර බයියෙන් එබවේ ගායන් ගායන් අරබදිද කැසුම් බලි ජුසාම් බලි ෆයිලරේසිස් මිකාල බලිත ෆුර්තම ඒ බලිතකන් අලුන් මෙන් कंट्रोल करवेन गोइतके इख्तियार करंच ए बालित कंट्रोल करवेन गोइ इख्तियार कोग्गे मेनवी राज्य के आम हालत वैगोतक दमेहटेन कम के यागिन कमन्ने मी अउन मेंगे एरुगे फुर्तम कम कवगे राज्य के कोमे अथोलेग हेल्थ सेंटर बाहट राज्य का बोडु एंग हॉस्पिटल मालेगा हुरीरुगा हतर दायराएगा हतर रीजनल हॉस्पिटल बेहटो आदि कोमे हेल्थ सेंटर का ए मिदन्ना हॉस्पिटल तक गुळवादे मी उलंदु फहर बलिमी हुं उफलाने हेल्थ लॉन्च नोत हेल्थ दोनी फहर अरुण में इंतजाम करो मी एरो अरुण में न मुद्दत के तेरेगा फुर्तम करे हरि कंत वर कोड मुद्दत के तेरेगा अरुण में एक कंत हासिल करो
इदोसर की आम सेहत के कंकम समालकम दीनमा वोरेम बोडा वाके की हेरन तेरिकन इतो प्रमोपुरम बोडा बलीमा बेस कुरुंगे सियासते कं इसकन दीगे सरकार के सियासत करने दिया दोसरे एहनमस नमस्ते अड्डिहा आहारत फेशिगेन इरु आम सेहत समालकन दिन मट्टका राज्य फुरतम हेल्थ प्लानिंग एकलवाले दिया एक तेरिंग नुकुमेन दिया අතුල්තෝග මසේ කුරාන අතුල්තරේ රඩෂ්ග මසේ කුරානේ ෆැමිලි හෙල්ත් වෝකර් ඒ ආයිලක්ස් කී හිතේ දැන් එදොසර් ප්‍රයිමරි හෙල්ත් කිය තාරෆ් මා ගුලින් ඒ අධ්‍යාග මෙතරේ කොරබඩ ෆාවෙන් දියල් වඩ මේ ආම්සිහි කන්ත ආම්සිහතුගේ කන්තක සමාල් කන්තිරෙන් දාක ඒ ප්‍රයිමරි හෙල්ත් කිය සූතකයි ගොත අමල් කරම් ෆෙෂොන් एक तेरेगा आसुकुन वाला पाहक को जो माइना कुड़कुतिंग सिखत बालक कंट्रोल करूं आम सिखत आवे को तुम हेलन तेरेगा इतो करूं आदि वैक्सीनेशन प्रोग्राम डिजीज कंट्रोल प्रोग्राम मी खास से इंडिया इनस में गीतरू में सुनना ने सैनिटेशन ना फेना निकंत तविस मैंने गंदा को था दें दस्तक बलाला है आलगुन में इदोसो नुकुद दोसो एमे बोडु दच्चक फाहा कुरेगन आलुन नदिये सिही मरकजिग मतल तेरेगा मसे कुरान एमे मीहक ए जमात के सिही ए तेरे एकani आदि आलुन में कुरिमस ए हुनने हेल्थ असिस्टेंट एकani एमे इथुरा एमे सेक्रेटरी बाहरवाने खातिबे सेक्रेटरी नरुहे आदि एनुमस मसकत मीहबस नहुरे एहनमस आलुन एकंकं हल्लुवेगन दी आलोनगे मसक्कೈ वकी गडियेन नेति हुरिहा गडिग्गास मसक्कೈ कुरुमा आदि अतोल रयितुंगे हुरिहम हेतिरकन लिबिगे
अध्याग तेरे पेट्टी कोम्मे अतोलिग्गा अतोल हॉस्पिटल है देतो एक बेन मक्की महाबन में हूँ कुल लिहाज तक तुझे इमरजेंसी करवा देवे को उसका पेट्टू राज्य महाबन में हूँ महाबन की तेरेगा पुराने का हिसाब दा मेंबर कुड़कुड़ एकम अनेकम की लापतुगा इंगार दशुग बिहा कुदिंग मरवा अदद मतकुर निस्पे मतकुर मैं मिकनी इन्फेंट मोर्टेलिटी रेट वुमेन एयर देवर मते को रे हमें को तो महाबन में हूँ मरवा रेटस ए को मैं इल्लक महाबन में है को व्यागन के 300 के कवर में हूँ यार मरवाने को एयर इल्लक के बनबुडन वाला राज्य एयर बनबुडवानी कारण को 12 हास्वर 10 हास्वर कम में නිස්පතුන් වරකුරාද මරවා එනමසේ දුනියග අලාකය මිංගලු තෙරේග උලයිනේ අයම මෙවටර් මොස්ටි බලන්න එල්ලක්කේ අවගුණ මසක පෙට්ටිතා මාගෙන දුවන්නුවේ යුනයිටඩ් නේෂන්ස් මිලියන් ඩෙවලොප්මන්ට් ගෝල් පට්ටා මේ බෙදී නවස්තයක නොවදිහේ බේස්ලයිනක පෙට්ටි නවස්තයක නොවදිහාග හුරි මිංගන් දෙහස් පනරය හිංසාව දාම් වයර තිරික්කුර
Mihai sabangaro amsihatuge waragina kantattaka wani improvements as rangal kureifa egotum gangen ara waragina balta control kureifa adibai balta mulin nattalefa wani rajye manna laddanin maruwa waru warabboda dakkure sihat warabboda rangal kureifa wani miharu rajyege life expectancy yaki gaganakan haddiya 4 waharu එහෙම මවර බොඩ කුරියරුම මිහාරුවේ සාමු සිහතුගේ කි කංකම්ගේ සබබුන් රයිතුන්ගේ සිහත වනි ලිබෙෆ මිහාරු අලුන් මෙන් එමෙ බොඩ ආමු සිහත කුරුමතේ ෆාව ගොන්ජෙම කි ගෑන්ගේ නාරා බදිත ගිනව එගොතුම් වරගින බලිතක කි මේ දිරුරම්ගේ වට්ටෆාලියා ගුලි ෆහොරි බලිත එකේ ආදත හෙලෆෙල වෙනුලුන් කෙම්බොයම ගාදත හොන්න ගොතුම් එකල් කංකම ගුලි ෆහොරි බලිත මිහාරු එමෙ ආමුවේ ෆරාජේ ගමියොති
ಜಮಾನ ಗಣ್ಣ ಮುಂದ ಬದಲ್ ತಕಾಯಕು ಆಮು ಸಿಹತು ರಕ್ಕಾತಿರಿ ಕುರುಮ ಕುರಾ ಮಸಕ್ಕೆತ್ತವೆಸ್ ಮಿವಣಿ ಬದಲ್ ಕುರಂಜೈಫ ದಿರಿಯೊಳುಮ್ಗೆ ವಟ್ಟಫಾಳಿಯಂ ಅಣ್ಣ ಬದಲ್ ತಕ ಗುಳಿಗೆಂ ಮುಜ್ತಮಾವ್ಗೆ ಆಮು ಬಲ್ತಕ ವೆಸ್ ಮಿವಣಿ ವರ ಬೋಡು ಬದಲ್ ತಕೆ ನ್ಯಾಸ್ಫ ಹಿತುಗೆ ಬಲಿತಕ ಕೆನ್ಸರ ಲೇಮಚ್ಚ ದಿಯುಮ ಹಕುರು ಬಲಿಫದ ಬಲ್ತಂ ಇತುರುವೆ ಮಿ ಬಲ್ತಕ ಫರ್ವಾ ಹೋದುಮ ದಿಗು ಮುದ್ದತೆಂ ಹೇದವೆ ದೌಲತುಂ ಕುರಂಜೆ ಹೇದ ಮಿವಣಿ ಎತ ಗುಣೆಂ ಇತುರುವೆಗಿಂ ಗೊಸ್ಫ ಎಹೆಂ ಕಮುನ್ ಸಿಹಿ ನಿಜಾಮ್ಗ ಖಿದ್ಮತ್ತ ಬಟ್ಟಂ ಕುರೈಫಾವಾ ಗೊತಾಮೆದು ಆ ವಿಷ್ಣುಮಕ ದಿಯುಮ ಮಿವಣಿ ಬೇಣುಂ ವೆಫ ಆಮು ಸಿಹತು ರಕ್ಕಾತಿರಿ ಕುರುಮಶಾ ದುಳಹೆವ ಮುಜ್ತಮೆ ಬಿನಾ ಕುರುಂಗೆ ಮಿ ಮಸೆಕ್ಕತುಗ ಸರ್ಕಾರುಗೆ ಕಮಾಗುಳೆ ಮೊಸಸಾತಕ ಅಮಿಲ್ಲ ಜಮಿಯಾ ಜಮಾಯತಕ ಎಹೀದೆ ಫರಾಯ್ತವಗೆ ಎಬ್ಬಾರುಲುನ್ ನಿಹಾಯತ ಬೇನುವೆ ಹಮ ಎಯಾಯಕು ಕೊಮ್ಮೆ ಫರುದೆಗ್ಗಿವೆಸ್ ಅಮಿಲ್ಲ ಸಿಹತು ರಕ್ಕಾತಿರಿ ಕುರುಮ ಕುರವೇನ ಕಂಕನ್ ದಿನಗಣೆ ಫಿಯೋಳು ತಂಗಳುಮಕಿ ದುಳಹೆವ ಮುಜ್ತಮೆ ಬಿನಾ ಕುರುಮ ಮುಹಿಮು ಕಮೆ
video and fen wadagen never got a varagina masikatake kure for me alone men tafatu kantataka kam vivagut alone memmi jehni deal kurang kuriga communicable disease mivagut non communicable disease alone menge for our next presenter is Dr. Ibrahim Afzal. He'll be introducing the roadmap. And Dr. Habib Farougi, WHO consultant, had actually worked with Dr. Afzal to develop the draft framework of the roadmap. And I would like to quote Mr. Afif again. If there's one country in the world that can change the health of every single person, that is Maldives. And hopefully we are starting from here today.
Bismillahirrahmanirrahim. Adarumange tinduhoge wara bura masek katuge MF ahumara he nando. Miga haigatu ekkamaki for the road map. Let's go to the next one. Could we go to the next? Oh, I have. Okay, so here we are at the road map. Miha road map ga furtam kam gamdane ege ki begen to alme road map e hada mi jon den iha waraka ekhala details ka Magan gotega mi roadmap benuwe eba sorry siyasi commitment public health ge kankamuga isnangawagen ega stewardship role ada kurmattaka ane benmaki community kankamuga community ya guligen masake kurun ei andewna maksudaki timanakam balafiya wara hama gotega MNWS khidma fora fada gotaka ekan kurun adi eki tafat data taka service ta mi integrate korevegen ebba kukura masakana beka ingigen mi fada integrated service system create kurun දැන් මේ ස්ලයිඩ් එක කියහගතුක මේ අරමුගේ මේ උපදාව රෝඩ් මැප් එකේ guiding principles එහෙම ඒ ගල්මනේ මේ කබඩ academic backdrop kama wati ehawara ege triya kanwanna ngeto it has things like community empowerment, addressing social determinants, equity, forging partnerships, and enhancing our responsiveness. Okay, now roadmap me behifawani haigeru magandu first theme mega macha alun komiska me karin kwa theme ka divehin kyani ki ba surhiye ke buna ma hingare ema first magandu surhiye ge macha me alun road map behifami wani ekතරෙන් එමෙ ෆුර්තම කමක මිනනි ආබාදීගේ සිඛත් දුලහ ආබාදී දෙවන තීමක බලාපන මිනනි පොලිසියා ෆයිනෑන්ස් තීමණය continuum of care මේ ගේ කොමසරක එක්ස්ප්ලනේෂන් බේනවන කන්නේ continuum of care මෙකනේ කොමසරක දෙමෙ හැටි නෙවි ගොතක දෙවේ ෆරුවා මණකි බලිමිහා මහම එකනේ එනගේ බයිය ෆරුවා දිනමක බදලුගා ඒනිය ඒ බයියා ගොලිෆවා එහෙනින් හොරියා කමක් ගෙවස් address කර මිසාලක ගෑන්ගේ නාරාෆද බයිය වෙජියා එන ඒ බල්ලිගේ risk factors වලකට එන හෙල්ත් තිරිකරුමා එනගේ ඒ follow up හෙදුමා එනේ දෙම්මණි කීතෝ එන හැම එකනේ හිසාබ බේස් දී ෆොනුවා නුලා ඒ වර holistic approach එකුන් full care දෙවේ වතර දෙවේ කාල ගොතක එනගේ ෆරුවා දිනුම් හැම ගොතුන් හැම ගෑන්ගේ අරාබයි යනමස් ඒ තනෙක් ගෙවස් ඒ හැම එකනේ මීහා හිසාබ ඈමනු නිම්මා ඒ රෂික් ගන්නම ඒ location එකවස් අල්මන් එබ්ජේ focus කරන් එම එකවර වර holistic approach එකුන් කියා මිදෙනි continuum of care then දුලේ හොතිමාවට ඒ දුලේ හොතිමාවශී කිතේ හිමිනෙන්ගේ તો හැම කනේ අල්මන් conventionally තිමාවට මි හීකුරා තිමාවශී කිතරුන් occupational health කාලා achieving එතෝ then almen kurimas wargena dekwe foin kame mi duniya huriha dimalakos bolani essi khataka dime daturu kuram wegen ehma fahu team ka minani essi khat mi magan first team ga matcha mi maguchat ekulo wale fami wani migen komme then genes wagot ki komme team ka almen mi gastu kurani mi team ge dashun konkon lanudan take bay almen hasil kuramane kon hisabake to almen gendam benoi e magu chart ge hegatu minani daane gotaka e wasil vene manzilaka enando e megotun goal team mi demaduga benumani daane magu ei harakatta mi harakatta through kon almen benwa lanudaniya hame mi hasil veni ingeto ema mi magan gotaka mi road map ke හයිගතක මේ road map के framework එක මේ දෙ මේවර මා elaborate වෙගෙන් දානෙච්ච තිබේ ෆ්ලොන්ගේ feedback का මේ හරියාච මේ involve වෙගෙන් මේ වකි breakdown වෙගෙන් දාන මේ වර simple ඒගේ goals and themes එහෙනම් ෆුර්තම දෙමින්නේ වකි first theme එක වහ දක්කාපි එහෙම කොම්මේ theme එක අල්මෙන් බලාපනම ආද මේ නැහැ 32 goals අල්මෙන් මිහාර මිහිරි ඒ 32 goals ත බේස් මෙවනි timeline තක මිකර කුර වාස්ලවම් බේනුම්වා ලොණෙන්තක එතන් ලනුදෙන්තක හාසිල් වෙවේනි කොන් ටයිම්ලයින් එකතෝ එහෙම ඉංග්‍රීසියෙන් තක කිහා හිසබගුන්ද කොන් කම ෆොරිහම වෙගෙන් දානි එහෙම බේසිකලි රෝඩ් මැප් ක ෆෙනිගෙන් දානි මි ලනුදෙන්තක ඒ ලනුදෙන්තක හාසිල් වෙවේන ටයිම්ලයින් තක then further minani healthy population දුලහ ආබාදී එහෙම දුලහ ආබාදීගේ දශොන් හයගතක වර ගින goals තිකල් මෙන් කනඩාෆ් වාන මිගෙන් බයි goals වරවස් ambitious goals මිහුන්නනි නේද එහෙම මීම හයගතුග මිහා ambitious goals බෙහෙට්ටුමගේ මහගන මක්සද කලොන් ෆෙන්නනි මි ambitious goals are nule almenaka beenuma push no devene so we keep very ambitious goals and hopefully it will give us that urgency to get the work done and then komisaraka mitwe fradi mi working group ke board of mi komme goal la ka med visna ya activities decide kurumage fursat libene ehma mi ka komme goal la kono dakan natin ehma fene to anen ken ilawa to mi har nuni algon repeat koram mi to horiyachi no need hanunto then hame gotun komisaraka alme action tekos almen faratun ekala as a template kala these it doesn't mean that these are the actions eko miwes sama egota howalefwa actions take ingeto activities take em harakat tawes almen komisaraka misale goto mini jahala ingeto ඒගොතරේගා මිහාර childhood vaccination campaign, monthly walk to school, එක බෑවර් කන්තතේ බෝරිං එත එකි තෆාත් හරකෑත්ත මෙදරවේගෙන් තෆාත් goals ahme වාසදේ කාලා. Then policy and finance balaf kamwana we need reorienting wah dekeve hindu alman benumane reorienting na benum wafada policy teke tarfa otun hamegota ekma benuma adequate budgeting otun adi demeheten gotoka finance alman public health fund finance krum migeturun NGOs a CSO ge collaboration na ege inclusion wara muhimmakama mi tindoge wahatakus mi wahako efani ema AWS almen koron kommen koren je kame ebe frunge utilization as equal partners. Then migotumas commerce kala activities take almen already exemplify kormata kam hini genessa me stiba from balalan commerce fursat dena then working group kam detail kon preference preference ge ane goals taka bayale wena then continuum of care balala alman gengole wellness model of service wellness model ki hum alman koring hum then continuum of care basically a ravara hamekani treatment of the patient and none e giturun ane patient ge treatment a gulifori preventive care ge kantatavas ega himene gota almange model change kolla meni mihar public health unit ge model la basically treatment and curative part any gag kolla difa dem egotun ekama guligen hori bawar harakatta mehiringata outreach wellness services migrant groups migaturun additional human resource capacity building hame wellness centers timaveshi ge goals ta kalu mihiri wara mes ambitious goals ta genge to elmirin dengue fada air pollution breathe life ke targets tang achieve kurung deaths by road traffic accidents wara boda reduce kurung mikama mes almen commerce wara activities take already thought of abori mi ahigatuga mi conference ke korea hori activities kama wati ve tibe fulunge input adi tibe fulun decide kro activities ta mi tafat ve huruma samara boda kishigem ve essi khataka wasu mattaka ege surveillance system wara rangala develop kurumara muhimmu adi wara gina bayaka negi onna wara muhimmu kamen e antimicrobial resistance ke issues ingata ema AWS almenge wara bot target aamunna ekama health teri kurumu adi dengue ge epidemics aun huttumu singata ei bali natta mage badla bekeni epidemic level la dium huttumu den hotline ge wahakes dege One Health ke darung kurma hamajefa activities nuni almen law for activities tamheri National Health Laboratory DHIS to real time surveillance system communication plan AMR ge goals reach kurung research and policy evaluation of the priority of public health issues yeah okay I need to be faster even then I think compilation of balafinama this is what we have ingeto mihar mihuri goals ta balafinama we have then alun kuris then for that me waravs ambitious ko mi goals ta mihiri ehma haigatuka dehas fansa we have that I think goal hasil we minna ingeto ehma hopefully we can achieve this and if we are to achieve this then it has to be a massive effort. And this more or less concludes my presentation. Because we have such a huge endeavor, of course, we have to seek help from higher authorities. So that's it. Thank you.
Dr. Afzal mi dengon almenge group maseketa komisarika group ke maseketa ane Dr. Afzal ki ubala devane first group aka ane group taka ane mi diha grouping in fact 5 teams at diha group komme group aka facilitator ka kon Dr. Afzal komisarika mi group hadana gota who the facilitator will be and kon group ki kobato hu diha ki ubala devane
Adi Salamwagen Devoniki no Henanta. Okay. Right. Dengoti Higatuka Tibeflunge input Benumane Hagigi Marhala. Ngeto Mihar Waka de Huriha goals Taka Tibefulna activities, prioritize activities, decide Kurmuge Tibeflunge Fursat Hulwalifa Mihar Katuga. Miga Alma Bahalan group ta Diha Groupaka Bahalana Ngeto. Groupaka Bahalan Kinikam Mihadani Alming. Fahatroga already they are facing towards me. Air jigging in row, turn to the Fahatro. Basically turn to each other, turn and face each other. Oh, it's right there. Yeah. 45 minutes. Yeah. Okay, who is taking over? Is it?
Me. 1 2. Me arengi jadeto. Ane me Fahatuge hama me. Meza devana roga fahatun devana roga tibi beflong embrillamvi then mikologa okay mi beflong then mi turn nagamvi geto mi roga tibi beflong turn nagamvi koba hinga embrillam mi beflong turn kolla denvi ad mi roga mi beflong turn kolla denvi okay to seri mi team mi beflo mi roga tibbe beflo hama mi kola tan kola devi mi meza tan kola devi nga buladam e masen algon me ero e goten hadana okay mi kola tibbe beflo embri lamve no madkoroch mi yes embri la Kava Mikologa Tibe Miroga Tibe Beflong Ebrilla Mijani, get me table. Ebrilla Jane, Mifali. Okay, though. Kava Afsar, Dr. Afsar, Neharama Gaikanaka team the Kulava Lefa Mivani, get though.
Koba team ta Huriha table take was form with or team take Gisifaga. Like this, okay. We have to quickly give them an A. Mit bahal jane Huria ane moderators. Is it moderators or modulators? I forgot. Your modulators, the moderators, the
modulators.
Are you modulators? I forgot which was the right word.
I don't know. Facilitators.
Yeah.
Is there a separate group for each thematic area, or is there everybody is working on everything?
Wait, I was hoping to get them all settled. Sorry about that. Maavashami turn call yesterday. Okay, each of the groups will be given a beflum masake kuravani commerce et themaka. Ingeto commerce et themegge hori goals taka activities tayar kurmuge masake beflum kuravani. We are expecting diha activities ingeto komme themege dashung. Ega komme huriha goals taka waka nujene because essentially where it is lacking mini system eti kuriya gendane. We just want your ideas and inputs. then yeah, facilitators will tell you which groups you are belonging to. Then waki special interesting hunna area hurikam vejia, we can move you to that group. Ingato. Echita liben ingato goal taka echi liben. Aren't you a modulator? Ada tables taka waki special area te kanala furi. Adi okay. Yeah, for the it will make more context once you receive your set of themes. Where are the moderators? Okay, they are coming. Good. So our moderators are making their way towards you. Hopefully they will reach you in time. Hada slow progress again group ta. Huriya kule ekkule kunta minani. Okay. I thought at least tafat kule kun kama dada ne. One Health, let me just say, libu for tanta. They have already received their. Okay. Just to let you know, me continuum of care table me ingeto me continuum of care table tibe flung terem working hama me topic work kuram berum fulwanama it's a good time to shift over here ingeto continuum of care will be working this table as well as me kong I need to know me kolo meri policy, this is continuum of care and this is the table lucky continuum of care. Ingeto second theme and second that's the theme. Me policy me table lucky is me was policy. So we have policy over here, policy and finance, and continuum of care over there, and over here we have combat to be fulnaki. Adi nenge God. Population health me right. Okay, me healthy population, ecology. How come these guys haven't got anything? Come back. The arrangement is horrible. Hey. Me One Health ke group hai. Me tha ganite वैसे group hai. They haven't got anything. Eh हमारे की group दी फमा गिने हफ्ते में हुन तो तमी. In that case, they can simply work as yet another group for that. Me tag tibegem work koreve any